I grew up in a small rural town in the mountains of southern Mexico, the kind of town that you can comfortably walk in the middle of the streets without worrying about cars. But with the joy and peacefulness of living close to nature came the financial struggles of living in a rural town and a middle-income country. So when I was 17, my family migrated to the United States looking for job opportunities and economic stability. I remember being impressed by the size of Southern California highways, the buildings in downtown LA. This transition really highlighted for me how the built environment shapes our everyday lives. But it wasn't until I served as a Peace Corps volunteer that I realized that deep relationship that exists between public health and the environment. I served as a public health Peace Corps volunteer in Senegal, West Africa. Senegal is full of color and culture. It's a beautiful country, but it also has many hardships, including high levels of air pollution and limited access to clean water. And I witnessed how these hardships impact the health of Senegalese. After Peace Corps, I pursued a doctoral degree in environmental health sciences. For my PhD, I studied the impact that exposure to air pollution has on neurodegenerative diseases such as Parkinson's disease and Alzheimer's disease. During my PhD, I also learned extensively about the inequities in environmental exposures and the resulting disparities in health. This knowledge really impacted the objectives and directionality of my career. After my PhD, I completed a postdoctoral training in environmental justice, and I began to engage in science communication and science policy initiatives as a way to make my scientific work more impactful. Currently, I am an environmental health scientist in the organization PhD Healthy Energy. I am expanding my research in the areas of climate adaptation and energy equity. I work in close collaboration with community-based organizations, policymakers, and stakeholders. And I am very passionate about using high-quality science and data to inform, refine, and reform climate and energy policy in ways that protect historically marginalized communities and benefit both public health and the environment.